After 1 year, they are not aware that they had a surgery.
Imagine having hip surgery and a year later, feeling so natural that you forget it ever happened. Let's hear from our hip surgeon in Istanbul to find how they make that a reality.
Dr. Nevzat Selim Gokay. I am a professor in orthopedics and traumatology section. I have been working for 25 years and I am expertise in joint surgery. I have been educated in Istanbul University. It is the oldest university in Turkey. Our implants are cementless implants, like here. I mean, there is a coverage over the implant. When we replace the implant inside the joint, there is a biological process. This bone and this implant will get inside and catch together and acts like a one tissue. The most important thing in cementless implant, think that you should choose the best size inside the bone as fitting replacement. If you choose a smaller implant, it may get loose. What we also perform during the robotic surgery, we plan the surgery. We plan the cutting surface of the femoral side, so we can put the size of the implant, we can use the size of the implant what we planned. It will give the best option of implantation during the femur. Also, we will arrange the deepness of this area. Because we use a robotic arm, there is a center of rotation of the hip. We know it before the surgery, and we know the other side also. You don't see here, there is the other hip. We know the rotation center. What we plan is to act like the original center of rotation of the patient. So during the robotic surgery, we plan the surgery, then a robotic arm comes and perform the acetabular rimming. And also the cup placement is made by the robotic arm. So usually you see there are holes here, which we don't want to use screws to increase the stability of joint, which most of the robotic surgeries, we don't use them. The robotic arm replaces the implant here, breastfit it is very, very stable. There is no screw fixation need for that patient. So we can balance two legs with a 1 millimeter sensitivity like the other hip. So it will increase, of course, the survival of the patient. Also, there is a study about that. After a year, they have performed a study with the robotic hip patients. The forgotten joint score is the highest in the robotic arthroplasty performance. After 1 year, they are not aware that they had a surgery. They forgot it because it is a very, very balanced surgery. When we perform it with the robot, we can perform a very balanced surgery. It is, of course, working for a survival to increase the survival of the implant, but also it is important to have a patient more comfortable.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.